As you can see in this picture, you can see this is a second trimester pregnancy, and that's not exceeding 14 weeks pregnancy. As you can see, this is the umbilical cord and this is the placenta, and as you can see, this is a short cord. Of course, the umbilical cord is normally between 55 to 60 centimeters long, and an umbilical cord less than 35 centimeters in length is considered abnormal. And of course, it's rather difficult to measure the length of the full umbilical cord because mostly the cord is coiling, and so you cannot see the loops of the cord and you cannot measure it. But in this picture specifically, you can see the cord continuous starting from the abdomen of the fetus up to the placenta and denoting a very short distance. Unfortunately, if the cord is too short, it means that the baby might not be moving and growing enough, signaling a potential health issue. Short cords can also pose a risk of numerous delivery complications and birth injuries. Short umbilical cords appear in nearly 6% of deliveries. Of course, we have to assess the umbilical artery blood flow and the umbilical artery Doppler for these cases, and to be sure that the amount of blood, of course, reaching the fetus is normal. But remember that the most severe complication of a short umbilical cord is placental abruption, and that condition in which the mother placenta pulls away from the uterus, resulting in a life-threatening maternal bleeding. And of course, in such cases, there should be that requires an emergency C-section for such cases. Of course, in contrary to this, the very long cord, and in cases of the very long cord, actually, we have the risk of true knot. And true knot also carries a risk of decreasing blood to the fetus, and so there is placental insufficiency, and it carries the risk of fetal distress and may end in intrauterine fetal death. And that's why also the very long cord is another problem for such fetuses. So please remember the presence of the cord or presence of the short cord as a real problem for such or for these fetuses.